Good morning, and welcome to our Community and Health Services Committee meeting for January the 14th. Today, we're going to be hearing from Dr. Fred Mather, who will be introduced by Julie Wheeler, the Director of Senior Services for the region of Waterloo. Fred will be making a presentation to us. I'd also like to acknowledge that January is Alzheimer Awareness Month. This January, the Alzheimer's Society of Canada encourages all Canadians to learn more about dementia, to better understand what people living with dementia experience in their day-to-day lives, their struggles, their successes, and their hopes. Awareness is the first step to fighting the stigma, reinforcing human rights, and pushing for policy change. I'd like to now call on Chris, Committee Clerk, to conduct the roll call.
Thank you, Chair. Regional Chair Redmond.
Present.
Councillor Craig.
Present.
Councillor Deutschman.
Present.
Chair Erb.
Present.
Councillor Foxton.
Present.
We have regrets from Councillor Harris. Councillor Hunick.
Present and accounted for.
Thank you. Councillor James.
Present.
Councillor Liggett. Councillor McCabe.
Present.
Councillor Novak. Councillor Salonen.
Present.
Councillor Shantz.
Present.
Councillor Verbanovich.
Present.
Councillor Williams.
Present.
Councillor Wolf.
Present.
Thank you, Chair.
As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is the traditional territory, the Haudenosaunee, Anishinaabe, and Chinatown peoples. We recognize and deeply appreciate the historic connection to Waterloo region, and we also recognize the contributions of Indigenous peoples that have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise that reconciliation takes place through learning and community building with Indigenous people who continue to live here. We are all treaty people with a responsibility to honor our relationships. Are there any declarations of interest under the Municipal Conflict of Interest Act? None. We have no presentations. We have no delegations. Moving on to the consent agenda, item number 6. If you wish to remove an item from the consent agenda, please indicate so now, as we'll not take any questions on consent items unless items are requested to remove.
Chair Erb, is the museum report in the consent agenda? Sorry that I lost my words there for a second.
Yes, it is.
Okay, I would like to pull that out if possible, please. Thank you.
You would like that, you want a question? You have a question?
Yes, please.
Yeah, okay.
Thank you.
Okay, go ahead.
So I really appreciate the accessibility modifications, which will be part of the renovation before the new opening. And I also really appreciate that we're going to honor more diverse histories in the reopening of the museum. And I'm just wondering if disability history is considered a part of that. And if not, can we make a point of making sure that we look into addressing that? Thank you, Julian, for coming on down.
It's an easy question to answer through the chair. The answer is yes. So we were looking at working with community to develop the broadest palette of stories. So.
Sorry, can you repeat that one more time? You're working with community to develop
the broadest palette of stories. So.
Broadest palette. Okay, thank you very much. That would include a disability history angle, I would hope.
Yes.
Great, thank you. Good.
Thank you. Any other questions while Julian's at? Councillor Wolf?
Through you, Mr. Chair. I guess I just wanted to express my disappointment that we're not opening the village this year. We're taking another year. And both the Heritage Committee and the Dune Village have taken the time to reset their, I guess, criteria or whatever, to, respect diversity, inclusion, reconciliation. And after taking that pause, we unfortunately penalized them in the budget by not opening the village and not giving funding to the Heritage Committee. So I think that we need to think carefully when we ask our organizations to do the right thing, but it seems to me we're penalizing them for doing it as opposed to rewarding them. I don't know if you have any comments on either of those.
It was more of yours was more of a comment than a question.
Mine was a comment, and I just wonder, do you see it as something you wish you hadn't done? Or like in terms of pausing to do, I'm just confused. Anyway.
Pardon me? Yeah, that was a budget decision that council made subsequent. Yeah, thank you. So I'm not sure if we need a response, but I don't see anybody eager to do that. Thank you. Okay, so my understanding is we do not need a motion to approve the consent agenda because we have dealt with that. Correct, clerks? Thank you. Moving on to 7.1, the Resilient and Future Ready Organization, a report from Sunnyside Home. I'm going to call on Julie Wheeler, Director of Senior Services at the region, to introduce the report, and then Dr. Mather. Julie?
Good morning, Chair Erb and members of the Community Health Services Committee. I am so happy to be here with you today, and particularly happy to be here during Alzheimer's Awareness Month. It's a month that's particularly important to us, but also important to our community, and a great time to reflect on the importance of supporting people who are living in our communities with dementia to live well. It is my great pleasure to introduce Dr. Fred Mather, who is the Medical Director for Sunnyside Home. Besides being one of our attending physicians, Fred also cares for some of the residents who live in our supportive housing program, and in the community, he works in the memory clinics. Dr. Mather has over 4 decades of family practice. He provided medical care to seniors in office, home visits, and in retirement homes. Dr. Mather has served terms as president of the Ontario Long-Term Care Physicians and the Ontario Long-Term Care Clinicians. When the former Ontario Long-Term Care Physicians Association transitioned from a charitable to a not-for-profit organization. As president of Ontario Long-Term Care Clinicians, Dr. Mather was a participant in the public inquiry into the safety and security of residents in the long-term care home system. His term also included undertakings during the COVID-19 pandemic. Dr. Mather is a graduate of Queen's University, Kingston, and has completed postgraduate training at the University of Western Ontario. Dr. Mather currently serves as Vice Chair for the Ontario Association of Residents' Councils and is an appointee to the Stakeholders Advisory Committee of the Retirement Homes Regulatory Authority. Without further ado, I'll introduce Fred.
Thank you, Julie, and it's a pleasure being back again to give my report. There is a slide deck. Can we go to the beginning of it? I'm not sure if I can advance it here. And you have a report in front of you, and I decided I would just highlight 3 items in the report, and that is infection prevention and control, something that's foremost since the COVID pandemic, quality improvement, and the palliative approach to care as it is described in the Fixing Long-Term Care Act. Next slide, please. Our vision at Sunnyside is to be a compassionate community that cares for all people, stewards the land for future generation, and where everyone has the opportunity to live a good life. Next slide, please. The mission is to provide essential services that support quality of life for each and every person in the region of Waterloo. Next slide. I first started as an attending physician at Sunnyside Home in the 1990s when my predecessor, Dr. Ann Crow, took over as medical director at that time. We were in the former building then, and it had some favorable features, but it became a Category D long-term care home, which was opportune in some ways because it made redevelopment necessary. When I tour learners through Sunnyside, I describe the former home as like houses that were built in the 1950s. Land was cheap, and people built sprawling bungalows on large lots. Unfortunately, for services such as portering and food transportation and other mechanical reasons, it did not fit the standards. So we had an opportunity to develop our current home of 256 residents in long-term care, as well as the supportive housing and the apartments for seniors. And that was just over 25 years ago, and it's nice to be part of the planning now for the next step of the development of our campus to accommodate the needs of the elderly and those with mental health needs in the community. Next slide, please. So in terms of infectious diseases, we really are on looking at 3 respiratory viruses: COVID, influenza, and RSV. I submitted the slide deck back in November, and this is from the Public Health Ontario website as to what the trends were at that time. And we're very mindful in order to be prepared. The SARS-CoV-19 virus is something that is going to stay with us. It's going to become more of a seasonal virus where we will expect the peaks in the fall and throughout the winter months. That hasn't happened yet. And the number of cases are leveling off. And I think that the impact on long-term care homes has been greatly mitigated by the vaccination program. I think we're up to about 6 or 7 vaccinations for many of our residents, and also the availability of the antiviral drug Paxlovid in some of the more severe cases. Since this graph, when I look at influenza, it had a sharp uptake in the province throughout the month of December. Influenza A, it's starting to level off. I don't think we were as affected in the region as much as other parts of the province. And RSV is one that we're really on the outlook for. I was at another facility this morning, and 2 of their 6 floors are closed because of positive RSV cases. And we're hopefully a step ahead with the RSV vaccinations, which those residents that hadn't received it last year, we've got over 90% coverage with following up on vaccinations this year. Next slide, please. So this is from the CIHI, Canadian Institute for Health Information website, and there are 9 quality indicators that are reported for all long-term care homes in Canada. And it can be specific for your home, your immediate area, and they still report it as a LHIN, the province, and the country. Next slide, please. So I'm going to look at 2 of the quality indicators here. The top one is potentially inappropriate use of antipsychotics, and we've been very successful in reducing this quality indicator. When I talk to colleagues, both nationally and internationally, if there's a sweet spot, it's around 10% because the criteria doesn't cover all the things where a prescription of an antipsychotic may be appropriate. And we're sitting quite comfortably at 11.4% right now. And that may be partly due to the institution of the butterfly model, which I've spoke about when I presented here before, where we take a more resident-centered, gentle approach to care of individuals with dementia and behaviors. The second one is use of restraints in the home, and we're below the national average, and this became a quality improvement initiative 3 years ago because we were actually higher at that time. We were around 7%, so we started a QI project. We brought it down. I've been comparing our data to other homes in the area, and many of them are at 0, and I'm wondering if we could get to 0, but there is a matter of reporting, and that is because there are restraints as are commonly used in the hospital, and there's what we call PASDs, person assistant or patient assistant safety devices, which it all depends on one's interpretation whether the person can actually remove whatever the restraint is, which may be the case of a reclining chair, for example. So there is some debate as to what the definitions are and what the inspectors want to see. Next slide, please. Throughout the new act, the Fixing Long-Term Care Act, which was passed in December 2021 and received royal assent the following April, the term the palliative approach or the palliative philosophy of care is through the act. And it uses the broader definition of the palliative approach, meaning that it applies to all residents in long-term care. Paragraph 12 says, every licensee of a long-term care home shall ensure that subject to sections, residents are provided with care or services that integrate a palliative care philosophy. Next slide, please. So this use of the palliative approach to care is more like the definition used by the World Health Organization. Palliative care is an approach that improves the quality of life of patients and their families facing problems associated with life-threatening illness through the prevention and the relief of suffering by means of early identification and impeccable assessment and treatment of pain and other problems such as physical, psychosocial, and spiritual. Next slide, please. So at Sunnyside Home, we have an approach to care which we call consent is a conversation. The inverted triangle here is what's used by Hospice Palliative Care Ontario and Advanced Care Planning Canada, where our approach is that we get to know the residents, what their values, beliefs, and wishes are, and that allows throughout their stay a goals of care discussion, how they want to be treated, how intensive they want their treatment, whether they wish to go to the hospital or not, or whether they wish to have cardiopulmonary resuscitation. But the important point is the peak that all the options are done through informed consent. The other schema there is what is called the current butterfly model of care, which is the approach of care where on one side, you have active disease management, and on the other side, you have palliative care, a part of which becomes end-of-life care, and that there is a continuum and overlap of the two approaches of care. Next slide. And there was, I think, another slide in there. Oh, it was the slide at the beginning, which referred to the presentation that the staff at Sunnyside Home, the director of care, one of our team leaders, and the chaplain, as well as myself, were part of. We presented a webinar to Advantage Ontario on October 2nd, in which we presented what you saw there, the death-friendly approach to end-of-life care, where we showcased our approach to providing compassionate end of care, which includes support not only for the grieving family, but also for the fellow residents and staff when someone departs our care. So that is a summary of my report, which has been submitted. I'm happy to answer any questions if there's any.
Thank you, Dr. Mather. I'm just looking here. Councillor Foxon.
Thank you, Dr. Mather. I just want to say thank you for all you've done over the years. I've sat here year after year and listened to your report, but your passion, your love for the community is just amazing. And I thank you so much for all that you've done.
Good. Thank you.
Councillor Shantz.
Thank you. And ditto to what Sue just said. But I do have a question, and it's about primary care, and not specifically at Sunnyside, because I think Sunnyside has come a long way from when I Christmas caroled there as a child in the 1970s. And it's doing very well. But as the system manager, I wonder, one of the things that I hear occasionally is a turnover in primary care, and I realize that that's a challenge across the whole area. But how do we try to have some continuity in the various long-term care facilities with the primary care? And has the recent announcements with nurse practitioners getting some funding, will that change that?
I think we're seeing a big change. When I was doing that transition as president of the Ontario Long-Term Care Physicians to the Ontario Long-Term Care Clinicians, when we went for a not-for-profit, part of our goal was to be a more inclusive body, which included nurse practitioners as an important part of our membership. And it's interesting, there was a little bit of a turf war at that time, because the physicians did not see what the role of the nurse practitioner is in long-term care. That has completely changed because models of care change, and we have, for example, at Sunnyside Home, a nurse practitioner who is in the home Monday to Friday, and she does rounds with the physicians, and then she's available for care. It takes a great deal of burden away from the physicians to have that back up in the home. Provides more staff to, more support to the staff, the registered staff in particular. So the basis of your question is an ongoing challenge, and it will be remain one. The fact that nurse practitioners are more part of the overall model of care in long-term care will help to meet the needs going forward, because as I've said here before, we're seeing residents coming into our home who have more complex, more acute problems, and also that's being seen in a shorter length of stay, which is not a bad thing because it means they're staying in the community longer. But we need to have more presence, more clinician present in the home for that reason. Okay.
Councillor Wolf.
Through you, Mr. Chair. Mine is more of a comment. Sunnyside is an example of, an excellent example of quality care in Waterloo region. And I was fortunate enough to have my mother spend the last 2 years of her life, this was before the pandemic, at Sunnyside. And the kindness and care that she received there was wonderful. And I would just like to thank you and all the staff at Sunnyside. And I wish that all of our long-term care facilities in Ontario and in Waterloo region could attain the standard we have at Sunnyside.
Well, thank you.
Councillor Deutschman.
Thank you, Chair Erb. Dr. Mather, thank you for coming in. Just had a question. As I was listening, I was trying to understand, and I note in your report at page 3, it talks about the palliative approach or philosophy of care. And I was just wondering whether MAID ever factors into any of the discussions or approach, which is the medical assistance in dying protocol, and how that factors into individuals' wishes when you're looking at the continuum here.
That is an interesting question. The answer is yes, but also maybe not as much as you may think. Boy, it's been 8 years now since the original MAID legislation was passed, and there was the revised legislation 2 years ago, and I'm sure most people here can name at least one, if not more, people that are close to them that have received MAID in the past year. It's not used as much in long-term care. It is provided in the home if necessary, but it's not that common. And a big reason for that is the consent issue, because one of the, although things have changed, you can't give consent before receiving MAID, and we deal, as you can see from that one slide that showed the number of individuals we have with cognitive impairment, that it may be a reasonable choice in providing options for end-of-life care, but they may not be able to give consent. Quebec has changed their own legislation on MAID that gives more flexibility to people giving consent in advance. The National Organization Death and Dying are strong advocates for giving advance consent, but that's not where we're at right now.
Good. Thank you.
Yeah.
Councillor Hunick.
Thank you, Doctor. I would further suggest that the less frequency of MAID speaks to the higher quality of care and the desire that our seniors have to continue living there. So thank you for that testament.
I certainly agree with that comment, and I can think of an example close to me and other examples where there's a failure of the system to meet the care needs of the individuals that have led to an individual's choice of MAID, and I think it's something we need to be aware of.
Councillor James.
Thank you through you, Chair Erb, and thank you for coming in and providing, an update and this information and all of the work. I just have a question regarding, there was a stat, I don't know what page this is, but it said female long-term care residents are 64%. Are you seeing that number increased? I find that significantly high, and I'm assuming that that means female, that is, single female, that is maybe unmarried or a widower or what have you. Are those numbers rising at Sunnyside?
I can't answer that question. I think they sort of parallel the gap between male and female life expectancy.
Okay.
I'm sure I could look and see what the answer is. I can't say whether it's rising or falling. My suspicion is it's not changing a whole lot, but it's an interesting question.
Yeah, just looking at comparables over year as well. So anyhow, thank you. I'm sure you can follow up with that information after.
If you look at the population we serve, let's say the over 80 population, which is leaves out a lot of important type of residents we have. There's far more widows than widowers in that demographic.
Any other questions? I don't see any other questions. Julie, did you want to have some concluding remarks?
Yes, thank you very much. And thank you to Dr. Mather, who, as I shared in the opening bio, has contributed an enormous amount to the sector, but on behalf of Sunnyside Home and our team, it's been a pleasure working with Dr. Mather and learning over the years from him and his tremendous leadership. Concluding Dr. Mather's presentation earlier on, he spoke about his experience in the early 90s, early 2000s, working with Sunnyside Home in the community to redevelop. And here we are, 2025. Much has changed, and there's much to think about and reflect on post-pandemic. Sunnyside Home and Senior Services is experiencing its highest demand in my career anyways. And it's a great opportunity for us to think about how we can best move forward. We've mentioned previously we are in the midst of a year-long project to develop a 10-year plan for senior services and for the Sunnyside campus. And we are looking at how we can grow, reinvent, innovate, and serve our community best. We look forward to engaging you in these discussions over the next year and talking about what we learn along the way and what the needs of older adults are in our community. Thank you very much.
Thank you. Thank you, Julie. Chair Redden.
Thank you, Chair Erb.
Colleagues, Dr. Fred Mather's dedication and impactful contributions to long-term care sector over the past 40 years are truly remarkable. His unwavering commitment, particularly the 34 years of service as an attending physician and 26 years as medical director for Sunnyside Home, has significantly improved the care and the well-being of countless patients and individuals. Dr. Mather's leadership and expertise have been invaluable, especially in the last 7 years where he has dedicated his time to the long-term care sector, sharing his knowledge to enhance the quality of care. His involvement on Residential Council Association Board and ongoing participation on the Ontario Long-Term Care Clinicians further underscores his dedication to improving long-term care through advocacy, guidance, and support. His lasting impact reflects a deep compassion for the residents he has served, an unwavering commitment to advancing healthcare in the long-term care sector, and a passion for collaboration leadership. Dr. Mather's work has helped shape the landscape of long-term care, and his legacy continues to influence the field for the better. So, Dr. Mather, thank you very much. And on a personal level, you were there for my mom at the end of her life, and you still remember I have 2 older sisters, which I bless you for. You have a huge heart and a very long memory. I have a small token of thank you to acknowledge this amazing contribution, not only to local long-term care, but provincially and nationally.
We can blur you out, Will, though. Shiny head will go there, though. Pardon?
So that's it for that.
On to item 8.1, Council Committee Tracking List. There are no items on the tracking list. 8.2, we have all received some information from Waterloo Wayside. Is there any other business? Our next, Chair Redmond.
Thank you, Chair. I would like to, through you, ask staff just about that piece of correspondence. It struck me as curious that it ended up on this agenda, but I just wonder if staff have actioned this in any way.
Yes, thank you, Chair Redmond. Yes, we've received the correspondence as well. Came to my office through Ryan and Councillor McCabe. And so we've reached out and we've set up an opportunity to connect with the organization in the coming weeks.
Thank you very much.
Thank you. Our next Community and Health Services Committee meeting will be held
Chair.
Sorry.
No problem. Just a quick question.
Go ahead.
Thank you. To Commissioner Sweeney, through you, I understand there's a community meeting coming up for the King Street Shelter in January. If you could provide some particulars about when and where and the topic will be that's to be discussed.
Thank you. Through you, Chair Erb. So yes, there's a regular meeting with the neighborhood community related to the King Street Shelter, and the focus of that conversation will obviously be sort of our general updates, but more specifically to share the plans for the wind down of the King Street Shelter on March 31st.
Good, thank you.
Any other questions? Okay, our next meeting is on February the 11th. I'd now like to entertain a motion to enter into closed session. Do we have a mover and a seconder? Moved by Councillor Wolf, seconded by Councillor Nowak. Do you use your e-scribe buttons to indicate your support, please? Oh, okay, excuse me. I need to read this out. The purposes of the closed session, personal matters about identifiable individuals and advice subject to solicitor-client privilege relating to financial write-offs, personal matters about identifiable individuals relating to appointments to the Grand River Accessibility Advisory Committee, personal matters about identifiable individuals relating to the appointment of administrative penalty program hearing officers, personal matters about identifiable individuals relating to appointments to the library committee, and a proposed or pending acquisition or distribution of land by the municipality, and advice subject to solicitor-client privilege relating to the LRT Phase 2 project. Moved by Councillor Wolf, seconded by Councillor Nowak. Please use your e-scribe to indicate your support. Right. Do I need a motion to adjourn? Yeah, I need a motion now to adjourn. Moved by Councillor Nowak, seconded by Councillor James. All those in favor? Use your e-scribe again, please. That is carried.
Chair Redmond?
Chair Redmond? Yep. Councillor Solomon and Councillor James, both in favor? Colleen and Natasha, both in favor? Okay, okay. Okay, down to the Waterloo County room. Thank you.